everybody. I'm Susan Collini, and welcome to our monthly roundtable at the Renaissance Center for Plastic Surgery, the Collini Laser Clinic, Age of Innocence, and of course, the practice of Francis Collini. So I'd like to introduce everybody today, and of course, to my right, your left, we've got Ronnie, who's our medical assistant. We've got Derek, the head of our laser clinic. To my left, your right, Marley, our physician assistant, and Sarah, our social media and marketing director, along with the manager of Age of Innocence. So, and we have an empty seat up in the front, so Ashley is with a client right now, so she might pop in on us, so I'll introduce her if she's able to show up shortly. So, our topic for today, everybody, is Emsculpt, and we've tagged this line, Kiss Me, I'm Irish, because we're going to talk about lip augmentation and lip plumper. Really the plumper more so than anything else. So, and I'm the only one that got a little green on. I'm a little pink. I'm not one that looks really good in green, but I figured the scarf would.
I'm just very Irish, so
I'll just shine. Yeah. Anybody have Irish? I have a little itty bitty bit.
40%.
Little bit. So all of us can say, "Kiss me, I'm Irish."
Yeah, absolutely.
So there we go. So again, if anybody hears all the trucks going by, they are pretty loud, and it's amazing that they do shake this room sometimes. And some of them are. You know, you wonder, okay, we are safe from the highway, but we can see them. So, I don't know if anybody out there saw our video that Derek and Ashley and Sarah produced. It was about a week and a half ago, I guess. It was actually on the Emsculpt, so you can see the Emsculpt actually in action if you go onto our page and you kind of scroll wherever they are. I'm really the novice at this. I can't find anything I'm looking for, so I'm really bad at Facebook. And so I'm sure all of you really know what you're doing, but you can find it. I think I'm going to let Derek talk about the Emsculpt and what it actually does and why we're talking about it now, because now is when we have to really think about beach bods coming up in June. You can't wait till June for a beach bod at all. So, you know, if we're talking about it now, you still have like 2 months before you might have to put a bathing suit on, and 2 months is not that long. So this might help you jumpstart into a good regimen of looking good and feeling good. So Derek, I'm going to leave it to you.
So Emsculpt, like we talked about in our video, if you come across that, it's a new type of breakthrough technology, sort of like when Botox came out on the market and changed technologies in the industries. It's the first ever machine that targets muscles and fat. So a lot of people, when they're looking for weight loss or they're looking to correct things with the body, they're concentrating just on fat. But this is going to go in and actually give you 20,000 muscle contractions on the area that you're treating at any treatment. So within a half hour, you're doing 20,000 crunches. And the great thing about it is there's no downtime because it's passing through that surface skin. It's going deep into the muscle and into the fat and giving you further contractions than you'd be able to do on your own. So if you're doing an ab workout at home, this actually causes 7 times more of a contraction than you would be able to contract your own muscles. So you're getting a lot more tightness and a lot more result. It's very intense.
For any of those of us that have had it, I've had it.
So the important thing everyone's always looking at is what numbers can they look at and what kind of results can they expect. If you're doing it on the abdomen, you're going to see about a 23% reduction in the fat. You're going to see a 20% permanent increase in the muscle. So what it does is it goes in and it gives you more muscle density. So you're going to see the cuts in your abs again, and anywhere that you're going to treat, because you can do other areas of the body as well. You can do arms, biceps, triceps, you can do quads, you can do calves. And then one of the most important ones, and I wish that Ashley was here for this, is the buttock. So this is a first ever machine that is going to give you a more round, larger buttock without having to go in and increase the fat content of the body. So what this is doing is building the muscles, but it's a special program. It doesn't touch the fat when it is put onto the buttocks. So you're going to get a different result with that, giving you that shapely behind.
I can attest to that
You know.
because I am of that generation of Twiggy where we liked everything straight and flat and no curves
Yeah.
and not the Kardashian look now. And I was really apprehensive about doing the buttocks, and they convinced me, you gotta at least do one. And I only did one. I didn't do the whole series. I only did it.
And that was about a year and a half
It was
ago.
over a year. It was like
Still
2 years
feel
ago.
that
And I
change.
will tell you,
Yeah.
I have had a very flat backside my entire life. I mean, it was probably, it didn't bother me, but it seemed to bother my daughter and everybody else, like, you don't have a backside. So I did this Emsculpt, and honest to God, everybody comments on the fact that now I have a little slope.
Yeah.
It doesn't go like this. And because my concern was I didn't want to grow out of my pants or, my size, so it's really funny, my pants actually fit better. They aren't as tight, low in the hips, and they fill out the top that used to be a little saggy. I can't
Gives you
explain it.
some lift.
And it's shapely. Now I didn't want to do any more because I think I tend to build muscle a lot, but it's amazing to me that it really worked. And I don't do any exercises to facilitate this, so it's strictly from the Emsculpt itself, and I'm amazed at it. So for me, I just thought it was an incredible result. And I've had patients that have told me, I don't know how they've told you, but really they said they've seen a big difference in their shape, and I'm amazed at it.
Absolutely. And another thing when we have people come in, especially specifically women, it does do some corrections to the diastasis recti, and that is the splitting of the muscle after pregnancy. So there are some postpartum improvements that you can see with this treatment as well. But it's great for men. I always say this in my videos because men are always like, is this for men too? Yes.
It's a six-pack developer.
It develops your
Yes.
six-pack. I mean, you'll see a big difference in the cuts in your stomach. And it's affecting all of the muscles in the abdomen when you do it. Now, I had a real hard time, I'm someone who works out, but I had a hard time activating my bicep muscles. So I did the arm, 4 treatments of the arms, and I'm amazed by it. I actually can see a cut in my arm now, and that was a year ago. So it has lasting benefits and immediate results, which is really good. With cool sculpting, which is a different type of treatment, you have to wait a little bit longer. But this is giving you some instant results, and then it's also giving you some fat reduction down the road in areas that are being treated.
Right, it does take a while for
the fat
reduction in both Emsculpt and cool sculpting, and of course we do both of those here.
Yes,
in
and
the
they're a
Clean
great
Laser
combination.
They are
Because with cool
wonderful.
sculpting, which we've talked about in the past, and if you have questions about that, you can DM us or contact us at the salon. But it only targets fat, and then if you combine it with the Emsculpt, you're getting the fat reduction and the muscle building to get you ready for summer.
I mean, that's an amazing thing. Patients have asked me, what if I really have some really extra weight? Am I going to benefit by it? And will I see those muscles? I think that's something that,
That's that's tough.
you should be the right candidate. It doesn't mean that you can't have it done. But one of the things that I think we do really well here is we have so many different options. We have the Verjus, we have cool sculpting, we've got the Emsculpt for lasers and fat reduction, and then of course we have surgery. So we try to custom your treatment based on your needs, and I think that's what we do really best. So if you're somebody that's really fit, but you're really dealing with skin issues and you have muscles, and maybe it's not quite the right treatment, but that's one of the reasons we really want you to come in and have a consultation and assessment. And we have a really, really cool special on Emsculpt. So I have to tell everybody to be quiet about this because I know they won't want to jump the price, but we have a contract with our lasers, and we have agreements that the ranges of the lasers must stay in a certain price range, and that's basically to protect you as the customer, because you don't know what you're getting if you're not really going to an Emsculpt provider. So the one thing we are allowed to say is that we've got one introductory offer at $299, which is unbelievable. Our regular package is at $3,600. We can't tell you what the new package is consultation. So when you come in for a consultation, you still get a value because you'll get that first treatment, and that first treatment is really a low price because it's normally about $900 to $1,000 a treatment. So to do that first treatment, and I said I only had one treatment.
Yeah, you do notice the difference.
Even with the one
after doing
treatment, I think you'll be pleasantly surprised. So that if you choose, you're not committed to do a package. But if you choose to do the package, we have a great bargain for the month of March. It doesn't mean you have to get everything in the month of March, but you need to contact us and facilitate the process during this time period. So we encourage everybody because before you know it, May will be here, and we are only 2 months. We're less than 2 months from May 1st. So then you've got Memorial Weekend, and you've got all these things. So, and Easter is early this year, so you might be putting on spring clothes as early as, what is it, Sarah? You know, April 4th. April 4th, because my son Joe and Sarah are 2 days apart. They're they're always Easter babies, so I always have to ask them when their birthdays are. So we always kind of remember it and celebrate it at Easter. But remember, that's a really good thing. The other thing that we're doing with regard to helping you get started very quickly, we do have a wonderful combination Cool Sculpting Emsculpt package. So that if you are more of a candidate to bring
That's
both,
when we're debulking a little bit.
really debulking, there is a major package benefit for both. So you'll get that on your consultation or introduction to Emsculpt as well. So we'll tell you, we won't let you just get the Cool Sculpting if you're really not a candidate. So, you know, we want you to know that. But if you really think that this is where you want to jumpstart yourself, it's a great jumpstart. I was very pleased with it. It's one of the things the reasons I purchased the machine to begin with for us, because it is very different from anything out there.
And there's permanence to both.
Right, and it's non-surgical, so I mean that's the really
And
really
non-skin interrupting. Both Cool Sculpting and the Emsculpt both pass through the surface of the skin. So if you're worried about some significant others, they don't want anyone to know that something happened. You're not going to see anything. You're just going to see that reduction starting to happen.
We do have a question.
Sure.
We have a question?
Questions?
I'm gonna pass it on for Derek.
Okay, Derek. Okay, we're passing it along. So I don't know what it says. I'm not good at
There's two
this.
questions.
Two questions. Okay, yeah, send your questions in. Actually,
So, for Sherry, the visceral fat, this is actually something that cannot be treated by really anything that you do. So visceral fat is the fat that starts to develop inside the body, behind the muscles around the organs. It is a more dangerous fat. It's a very unhealthy fat. So that's actually, we always encourage people to have a very healthy lifestyle. If you're spending this money and you go to Burger King and you're eating Burger King every day, you're still not going to see these great results, and that's no fault of ours. It's just you have to be responsible for your health as well.
I know not 100% Burger King.
And and it's not Burger King's
No,
fault
we don't
either.
have
I mean, everybody loves a good cheeseburger. I'm not knocking that. It's just you have to be, conscious of what you're doing. So with visceral fat, that's lifestyle. There's nothing that can treat that. There's nothing that penetrates past the muscle wall to get into that fat on that area.
The one thing I want to add about visceral fat, and maybe Marley can chime in as well, although these treatments, including liposuction, do not address visceral fat, the one thing that I can tell you with my experience with patients and clients is that it really jumpstarts them into dieting when they've gotten some of the subcutaneous fat off of them, or they're feeling better about themselves and they can get out and exercise. Because the only way to really address visceral fat is dieting.
And the way to understand visceral fat a little bit, if you're somebody who's watching and doesn't really understand the difference of that, the things that we treat are called pinchable fat. So if you're sitting here and you have that little bit of something, I'm in my 30s now, so I do. If you could pinch it away from your abdomen muscle, that's pinchable subcutaneous fat. That's what we can treat. If you see, visceral is very common in a lot of men as well. If you see they have these big hard bellies and there's nothing to grab, that's visceral fat, and that has to be done through lifestyle.
Right. I don't know if you have anything to add there, Marley.
Yeah, no, I think that was really good. Just, that not even surgery can address visceral fat, but it's just lifestyle.
Right. All
Makes
right.
a big difference.
Yeah,
doesn't it?
when people feel better and confident and have that jump start, then they're more likely to have a healthier lifestyle and exercise more,
Absolutely.
diet
And
more,
it's a jump start for them.
yeah,
And
definitely.
so, were there any other questions?
No, that was just the other was.
What's the
just
average number of treatments people usually get?
So, you know, for your introductory to Emsculpt, 4 treatments is what gives you those percentages. So 4 treatments is what gives you the 20% increase in the muscle and the 23% reduction of fat. So you can go beyond that. They suggest taking a little break, but you can go beyond
They
that
really-
even with goal sculpting
They really
as well.
did suggest 6. We
Yeah.
kept our packages at 4. It seemed to be more affordable for clients and still give them that nice break. And then once you get beyond that 4 package, we really discount
A lot.
for your life, you know.
Same thing as goal
It's
sculpting.
really amazing that we really discount it. You get a really low price so that if you need a tweak on an annual basis, you can get the service at a much less cost than opening numbers. But this is the best price point that we've had that I've seen in a long time.
It is.
So
And if you're an Instagram user, Emsculpt is everywhere. If you look it up, all the stars are doing it because it's a great way to work out without having to work out. So you'll see it in a lot of different places. I know Jennifer Lopez is a huge
and you
pusher
do it
of
within 2 weeks.
Emsculpt.
This all happens within 2
Yeah,
weeks.
You make a big difference in your body, a very big
And
How
difference.
often do you have to come in for?
Twice a week for
Twice,
2 weeks. Yeah.
And
Yes.
how long does it usually take?
So when you're doing the abdomen or the buttocks, so each of these do a different thing. There's different cycles that it runs through. So it runs through like a
It's
tough
very
hook band.
weird.
And because
tell
you're
you, it's
doing
very
these
weird.
20,000 contractions, you're going to be sore in the morning. So there's a portion of it that runs through it. It breaks down the lactic acid buildup and it kind of makes you more comfortable. But then when you move on, there's different pieces for the bicep, tricep. You can really treat anywhere that the muscle can have contraction easily, obviously not near cardiac or anything.
Yeah, we can't do
But-
the chest.
but,
Men or women,
um,
we can't put those paddles.
Abdomen and buttock, half hour. Extremities are 20 minutes, but you're still getting the 20,000. It's just you can push those muscles a little bit faster than you can the abdomen because it's such a large muscle. So between 30 and 20 minutes, and it's intense. It's comfortable. You're not in pain. It's just your arms are moving, and you could really feel that it's contracting your muscles.
Does its job.
Right, so I suggest that if you have this 1-year COVID weight on you, you need a jump start,
Now's
and you're
the
getting
time.
your stimulus check.
Yeah,
your stimulus check.
It's a great way to spend it.
That's it.
For your tax return.
Or your tax return.
Or your tax return, that's right, this is perfect timing.
Yep.
Yes.
So, that being said, I think we're good with Emsculpt and Body, so I wanna get
Yeah, any
into
more
very
questions?
quickly about, lip augmentation, because it was Marley's idea to, let's do a segment on Kiss Me I'm Irish. So of course we have to talk about the lips. And, for those that ask, right now, I haven't had any filler in my lip for about 4 years. I do have big lips naturally. But, I haven't had lots of filler, and I have tried it, and they have been pretty large in the past. And
We all like a
people
little
have
filler.
really teased me over the years, and I haven't minded it. But now that I'm getting older, I try to just stay down a little bit. Just
You got great lips.
But thank you. So I know how to put the lipstick on well. So anyway. I think that one of the best things, there's a lot of things we can do with lip augmentation, and we can use filler, obviously, which is the most common. And then, of course, we can do a lip surgery, which is a lip lift, corner lip lift. There are a couple of different things surgically that you can do without doing implants. And, of course, the last thing is doing a lip implant. And I have to say we do them all here, and I think it's wonderful. For anybody that's venturing out for the first time and really you're wondering if you will like this or not, always go with the lip filler first. Don't go into lip surgery or an implant first. Make sure that you take baby steps first and not jump into the big thing.
Do you suggest that they get something that's maybe dissolvable at first, so so that in
Everything
case
we-
they don't.
Everything we put in the
Is
lips,
dissolvable.
or you should put, is a hyaluronic acid.
So maybe we can.
So the hyaluronic acids, are those type of products that you hear, the Juvederms, the Perlane, the Restylane, of course the new RHA collection, the Revance.
Which we love.
We love that. We did the last.
Very
we did,
soft.
We did a segment, 2 segments ago on that, and we love
We're
it.
still on it.
We're still on it. So all of these are hyaluronic acids, which means that once we put this substance within your lip, it binds with the water that
Molecule.
is in you, the water molecule in your body, and so that you can, if you've had it done, sometimes you can see it be a little bit fuller than others. And patients have
You're
said
extra
that to me,
hydrated?
you're extra hydrated, you see a little added plumpness. So it's a really nice thing, and I think that, of course, young women, it's very stylish to have full lips, but I think as you get older, I don't think women are looking for an actual big lip. I think they're looking for
Line correction.
line correction, or, because we get lines around our lips, and actually that was the reason that I did have filler in the past, was because I had those little vertical smile lines.
And they do
around
get, your lips do get sun damage. People forget that, so you will start to see some wrinkling and some loss of density in the lips.
And so just to get that rejuvenation, we can go with something that's not as plumping. So there are different levels of hyaluronic acids based on their viscosity. And I don't know if you want to add to that, Marley. You and Ronnie work with that every day.
Yeah, I just think that the lip fillers are so great because just filler in general is great if you're thinking about a surgical, something more permanent, because you could have the filler, see if you like it, if you want more, if you want less, before you do something permanent. So I just think that that's such a cool thing about fillers, is that before you really commit to something, it's like a
It's like a
temporary
test drive.
Yeah, and the filler that we use for the lips the most is the Juvederm Volbella, and it lasts up to about a year. But like Susan just said, she hasn't had any filler for 4 years, so sometimes you can have some lasting plumping effects too. And then we also, when you come in and have the filler injected, we put a cream on your lips to numb it up. So it's really, hopefully Ashley comes too, because she's had lip filler to talk about her experience. But most people, it's really not very, it's a pretty painless experience, with the numbing cream.
They're surprised. Plus,
Yeah.
it's much better now than it used to be in the old days, because I was probably the original guinea pig, 20-some years ago.
Yes.
And it was pretty painful to go through the lips before we got we had these
And
topical
I have to
anesthetics.
say, we're all biased, but Doctor has a phenomenal technique.
He
I
does.
see a lot of his lips, and he does a great job.
Yes.
They're extremely natural. You're gonna get what you want.
Right.
You can go from natural to a voluptuous full lip, but if you're just looking for a little bit, I've seen it.
Right.
It looks fantastic.
Yeah.
I think we like to undercorrect first,
Yes.
because you don't know what a patient really wants, and I don't always think they know what they want right away. So I know when Ashley first started, we did the less viscous
Could always add
amount.
more.
You can always add more, but you can't take, you could take away, but it's very
Much
painful to
harder to
take
take.
away. So we don't want to do that if we don't have to. And then once you've done it once or twice, patients usually know what they want. They know that they want a big pout, they want some Kardashian lips, and or they just want to modestly fill their lips so that they don't look deflated and aged. We do age in our lips, so it's something to think about.
What's like an average, just wondering if someone's on their lunch break and they want to come get, what's an average time frame for someone when they're getting an injection of the lips? Less than an hour probably.
Oh, yeah,
The actual procedure?
So it's,
The actual
about-
procedure is a couple of minutes,
Yeah.
but the longest part is sitting with the numbing cream on your lips.
to wait,
that
so you have a
it-
comfortable treatment, but
Right,
it's something
right.
that you can do.
Oh,
Right,
yeah.
it's an
Quick.
office visit, it's not a
Yes.
surgical
Just
setting.
Just so people, some people get scared when they hear injection or they hear something like
Yeah.
that. It's a relatively easy procedure.
Definitely, yeah, under an
And then
hour for sure.
it's- The nice thing about filler,
It's instant,
Yes.
it's instant gratification. Now,
Instant
remember, we
gratification.
do give you some ice packs,
Oh,
and
you will be swollen.
your
You'll
lips
be-
will be swollen. They won't stay that way. So if you
Yes.
really like them that day, we're in trouble. You really should have more
You
because
need a little
the
extra.
the swelling is going to come down, and they will look much more natural within a couple days. So you have to be prepared. You don't get a filler the day or before you have a wedding event or a reunion or anything like
Yeah,
that.
this is something
You
want to
make
do
sure
in
that
steps.
you've got it
Yes.
done way before the event, and that you're used to whatever it is that you want.
And I
Before
just-
summer.
Yeah,
Right.
yeah. There was a patient who was getting married in, I think it was like a year and a half, and she got lip filler because she wanted more full lips for her wedding. But that was ideal. Like try it out, you know,
Way
right before. Yeah.
before.
So that way, then you have time to get, you know, if you don't really like it, you want more, you want less, then you know it's
You
worn
build
off,
upon
and
it.
then you could, yeah.
Right, because hyaluronic
Right.
acids basically, you know, the companies say that they last a year, but honestly, if you get a good 6 months out of the filler, it does last that long, a year, but you're gonna start seeing it deflate within 6 months, so it'll
Yeah.
slowly keep deflating. So you still will have filler, so the companies are actually correct. It's just that you will notice that at the 6 month point,
fullness starts
the
to-
the fullness starts to subside a little bit, and you'll notice that, and then patients want their lips, so, you know, but sometimes the more frequently you do it, then you do have some
Build
staying
up a
power.
little.
And some people just metabolize filler more quickly than others, completely independent of anything we can do or anybody has
Just
any
your
control
body.
over. It's just how your body. Some people just metabolize it more quickly than others too.
So fillers are really great right now. We're having a major special in the month of March, so that you can really kiss any Irishman that you want in the month of March.
That Irishman belongs to his lips.
And this is actually exciting because many times women come in and they only get their upper lip plumped. So for the month of March, we're offering all of our fillers, so you can try whichever ones you want. All of our fillers, you buy the first one, you get the second one half off. So that's amazing. So our fillers range from $500 to $1,000 a vial, depending on the product. So there are multiple products in our arsenal. We do everything. So, you know, jump on board if that's what you're interested in. But any of the fillers in any combination too. I don't always recommend that so much, but people might have different wants and desires. So if you happen to call in for an appointment, just let us know which filler you're looking for, or if you don't know, then we will guide you. But sometimes we keep, and I don't want to always say which products, but we keep certain ones a lot on the shelf because they're our bigger sellers, and some of them we may have to order for you if you want something specific. But we do have accounts with all the filler companies, and we can inject anything that you're interested in.
I want to give Miss Lauren a little plug here, because one of the other things that we have to take us a step further is we do cosmetic tattooing here. So one thing I also see with people is they get fillers because they're thinking that it's fullness that they're lacking, but once in a while it's actually coloration. So you're starting to lose what's called the vermilion border, and that is the outside of your lip, the lip line that defines where your lip is to skin. So sometimes that coloration can either be weak, or you'll see an unevenness when you take a photograph. So Lauren goes in, and this could be, you know, pre-filler or however you want to do it, and she could correct those little subtleties that may not be able to be corrected with the filler. So we do have that available as well.
I have to say, I love my
Yeah, you
tattooed
have
lips. Yes, I've tattooed lips.
It's a great color.
And I think that, I mean, it's amazing because I can get out of
No
the shower
fuss.
and look like I'm
Right.
not dead. You know, because the older you get, it gets harder to, you know, eyeliner and all that is harder to
Start
put
losing
on.
your borders.
You lose your borders wherever. You lose your borders. We're talking. That's a really good, you know, intro. That's losing your borders. But that's a really good thing. And one of the other things that we didn't talk about, the actual surgical procedures that we do with regarding the lips. So sometimes patients don't always notice this, but for women that are aging, the distance between the end of the nose here, this is called the frenulum, by the way, and this area gets elongated, and women start realizing realizing that they're losing their upper lip, and you're getting a little aging from the side, so you actually don't see your teeth in the same way. And they think that their lips have just gotten skinnier, but one of the things that we do is we do a lip lift, and we actually make a little incision right under the nose. It's hidden very well, and we actually just lift that skin, take out a little sliver of skin, do enough that it actually lifts up the lip, and it is one of the most beautiful procedures. Every woman and any of our men that work here that see this operation, the results are just amazing. So you don't get that big fat lip that some older women, I shouldn't say older, more mature women do not want. But they get to see more of their own natural lip, and they get to see their teeth, which is important. That's one of the things that people don't realize, because your smile is so important. So that's a lip lift. We also, there are some patients where their lip actually turns the corners down. So one of the things that can be done is it's called a grin lift, and there's actually a little corner that's excised out just above the vermilion border, and it actually lifts the corner of the lip.
Turn that frown upside down.
Turn the frown upside down. So those are two lip lifts that we do. There are others that are a little bit more involved, but those are really the two most popular, and I think the easiest for anybody to go through. And then finally, we have actual implants that we use. They are soft silicone. They are wonderful. Every single patient that has had them from us, from this company, they look so natural. They feel natural. They feel like their normal lip. They love them, and it's permanent. So somebody that is really chasing fillers all the time for their lips, I mean, I have to say, I've been talking with Ashley, because she loves to fill her lips, that, you know, an augmentation with an implant might be the option, because in the long run, it's definitely going to be cheaper. It's permanent.
If you're a few years in,
yeah,
it's time to consider.
you know, so here at this practice, you know, not only do we have all the options that we can suggest, but we also understand that your pocketbook, you know,
there's limitations.
There's limitations. So we try to suggest things that are more affordable for you and over the long haul, and we can, you know, tell you that. So I think that that's really important. And I don't know, do any of you have anything else to add?
To treat those beautiful lips once they're tattooed and filled, we also have our own brand of a lip plumper that everybody really loves. And one of the important things about our lip plumper is there's an SPF in it. So it's a mineral-based safe SPF, which you should always be using, because just like your skin's getting damaged, your lips are getting damaged when you're in the sun. So if you put all this money into those lips, you want to keep them really nice. So it's a hyaluronic base. It's going to plump them on its own and give them a smoothing effect over time, because there's some correcting peptides in it. So even if you didn't want to take any of these routes and you just want a smoother lip from a lip plumper, we do have our own brand of lip plumper as well.
It is really
which
nice.
I love.
Everybody loves
I
that
use it
product.
and I don't care.
Plump
these babies up.
Yeah, and people do get skin cancer on their lips.
Yes.
So that's just, you know, people are always putting lotion with sunscreen on, and then they just totally forget about their lips. Yeah, and that's a terrible place to get skin cancer.
That's
I mean, nowhere to get skin cancer is good, but if you have to have, you know, something from your lip excised, that can end up being
disfiguring.
Yes, absolutely. Yeah.
I think I'm being a little premature, but probably when we get into May, our first roundtable in May, we'll probably be talking about sunscreens then, because that is a skin cancer awareness month. So I know a lot of people come in and actually get their moles removed. So we'll talk about that. Maybe we'll give you a month sooner, maybe in April, but that will be coming up. And I think at this point, I don't want to talk too long. Does anybody have anything else that they want to say before we sign off? And we can say our next roundtable is actually April the 7th. So that's Sarah's birthday.
Wow, exciting.
Yes.
30 now.
Yes, yes. So it's really, you know, foreign because Easter's early this year. So and so the last day of March is the 31st on Wednesday. So we will see you April the 7th, and we will give you some information about what our topic is so that you can join us. And in the meantime, I think that everybody should kiss everybody because they're Irish, right? Ciao, everybody. The Italian came out. We'll see you next month, and have a happy Easter.